3 days after chemo. Been a rough ride. It's definitely, you read all the words and you try to expect the unexpected, but the nausea was completely intense.
Man, chemo was a eye-opening experience. I tell people when they ask me what did the symptoms feel like, they feel like the worst ever adult hangover and the worst flu for 4 to 5 days. I can't eat. I can drink water, which is great, but I can't eat. I've learned that eating during chemo makes me even more sick. So I just choose to kind of fast for those 3 days until on the 4th day I resume eating. But that's my personal journey, right?
First off, thank you for sharing that, because that's the reality that doesn't get talked about enough. The nausea, the inability to eat, the exhaustion, these aren't just side effects to push through. They're signals that the body needs support. And here's what I do differently with my patients. First, we use lower doses of chemo. This has several advantages, including a lower risk of side effects. It also allows us to give chemotherapy more often, hitting the cancer cells more frequently in an effort to kill cancer better. And second, we augment chemotherapy using evidence-based strategies such as fasting, hyperthermia, and intravenous vitamin C, even insulin. Then we use targeted repurposed medications and supplements to further weaken cancer cells in ways that chemo cannot. And fourth, we employ strategies to support the body as it fights cancer. These include a nutrient-dense, minimally processed diet in order to give the body the strength it needs, as well as various immune-boosting therapies, including mistletoe and lymphatic therapy. Using huge doses of chemo and expecting that to be optimal feels outdated and archaic. There's so much more we can do, and that's what integrative oncology is all about.